Dear audience, let me introduce my PhD thesis, which is the impact of triglyceride level on the risk and outcome of different diseases. My name is Luca Havelda, and I'm working as a dietitian at the Institute of Pancreatic Diseases, Semmelweis University, and I'm also a PhD student. According to my vision, I would like to really contribute to the prevention of diseases in association with hypertriglyceridemia. Therefore, my mission is to provide evidence-based and valuable data in this process. I have two specific goals to reach my mission. Both of them are investigating the effect of different triglyceride level, the first one on the development of diabetes mellitus, and the second one on the outcome of COVID-19. I started these two projects during this autumn. My first project is investigating the effect of different triglyceride level on the development of diabetes mellitus, and we would like to do a systematic review and meta-analysis. The prevalence of type 2 diabetes mellitus more than doubled in the last 20 years, and according to the literature, more than 90% of these type 2 diabetes mellitus cases are preventable among men if the risk factors are eliminated in time. Hypertriglyceridemia can be a potential but modifiable risk factor of diabetes mellitus. Therefore, our aim would be to investigate the dose-dependent effect of hypertriglyceridemia on the development of diabetes mellitus. It is also quite important, the relationship of these two diseases, because the prevalence of hypertriglyceridemia is also quite high. It can affect almost 1/3 of the population, but during middle-aged men, it can reach almost 50%. Our clinical question: does hypertriglyceridemia dose-dependently contribute to the development of diabetes mellitus? And we investigated adult population with different level of triglyceride, and the outcome of interest was the development of diabetes mellitus. According to our hypothesis, hypertriglyceridemia is a dose-dependent risk factor of diabetes mellitus. To find a useful article, we have conducted a systematic search during autumn in 3 main databases with 3 domains. After the duplication removal, we have left with more than 21,000 articles, and for our final analysis, we were able to include 203 articles. With the help of the reference chaser, we were also able to find 70 more eligible articles for our research. As I mentioned, the outcome of interest was the development of diabetes mellitus, which is a highly prevalent chronic disease, and it can contribute to the development of other diseases such as cardiovascular disease or kidney disease. Therefore, it should be prevented. Hopefully, we are going to be able to analyze more triglyceride-related indexes and factors, but first, let me show you my finished analysis on the different triglyceride levels. It is only preliminary data. We hope to find a little bit more data on that. So, as my first philosophy, comparing the odds of incidence of diabetes of those who have hypertriglyceridemia, which means that the triglyceride level was higher than 1.7 millimole per liter, and it is compared with those who did not have hypertriglyceridemia. We were able to include 8 cohort analyses for this analysis, and the heterogeneity is quite high. It can come from the differences in the population. For example, in the first article, the population mainly consisted of elderly men, and on the other hand, the mean age on the last one article was only 37 years, and it consisted of more female than male participants. So this can be the reason of the high heterogeneity. The pooled odds ratio is 2.17, which means that there is a more than 2-fold higher risk of developing diabetes mellitus for those who had hypertriglyceridemia and baseline than those who did not have. This result is statistically significant and also clinically relevant, and it suggests that hypertriglyceridemia is a risk factor of diabetes mellitus. For my second forest plot, we have compared 2 different groups, those who did have a borderline or elevated triglyceride level, which was between 1.7 to 2.3 millimole per liter, with those who did not have hypertriglyceridemia. In this case, the population were quite similar. This can be the reason of the low heterogeneity, and the pooled odds ratio is 1.45, which means that there were a 45% higher chance of the diabetes development for those who had borderline triglyceride level. It was also statistically significant and clinically relevant. In my last 4 reports, we have found an even higher odds for the incidence of diabetes. Here we compare those who have a high triglyceride level, which means it was higher than 2.3 millimole per liter, with those who did not have hypertriglyceridemia. Here the odds ratio was 2.16, which means that there were also a more than 2-fold higher risk of developing diabetes mellitus during the follow-up time for those who have the high triglyceride level. It suggests that hypertriglyceridemia, a dose-dependent risk factor of diabetes mellitus. The strength of our research is the transparent methodology, the large patient number, and that we are going to be able to analyze different triglyceride-related indexes. And the limitation is the heterogeneity, which is quite high in more forest plots. It can come from the population, and that we have included retrospective studies as well. As a conclusion, according to our finding and these articles, we can say that hypertriglyceridemia is a dose-dependent risk factor of diabetes mellitus. Its clinical implication is to be able to educate patients on better on the prevention and to create better follow-up visits according to the predictive risk of diabetes mellitus. And its implication for research is to find the most useful and effective lifestyle strategies to reduce triglyceride level, because with that we are also going to be able to reduce the risk of diabetes mellitus and to investigate the dose dependency in higher cutoff values or maybe with other cutoff values within the normal range. Currently, we are concentrating on finishing the data extraction, and we are also started the risk of bias assessment. My second project is investigating the effect of different triglyceride levels, but here on the outcome of COVID-19, and we plan to do a registry analysis. From 2019, COVID have affected millions of people, and its outcome was influenced by many factors, which should be able to identify to be able to interfere as soon as possible or even do early intervention when needed. According to the literature and the latest studies, hypertriglyceridemia was associated with inpatient mortality and severity. However, the association between the different triglyceride levels and the outcome is still not clear. Therefore, an aim would be to investigate the dose-dependent effect of hypertriglyceridemia on the outcome of COVID-19. Here, our clinical question is, does hypertriglyceridemia dose-dependently worsen the outcome of COVID-19? And we plan to investigate adult patients with COVID diagnosis with different level of triglyceride, and the outcome of interest would be the mortality, intensive care unit admission, the need for mechanical ventilation, but we are interested in severity and length of hospital stay as well. We hypothesized that hypertriglyceridemia is associated with worsened outcome of COVID-19 dose-dependently. Its clinical implication to be able to create better patient care. For this analysis, we would like to use the coronavirus registry, which was created by Catalog study group, and currently it has the patient number of more than 1,700 cases. As a summary, I have 2 ongoing projects. Both of them were started during autumn, and we plan to submit the first paper during this spring or May. Thank you for your attention, and always remember Hippocrates' wise word, leave your drugs in the chemist pot if you can cure the patient with food. Thank you.
Congratulations for the presentation. I think, which was the first, your first topic?
It was
hypertriglyceridemia or the diabetes? That's a question to me. Because sometimes you see in the not well controlled diabetes has high hypertriglyceridemia.
Yes.
So I think you can do subgroups well-controlled diabetes. And
so the clinical question is that does hypertriglyceridemia dose-dependently contribute to the development? Therefore, we have excluded those patients who did have diabetes before. So we only investigated patients who were diabetes-free at baseline, and after the follow-up, we investigated whether they have developed the diabetes or not. So, but it's a really good question. In the last progress report, someone said that it is like the question that which was first, the egg or the chicken. So the association is quite clear that there is something, but usually the articles are concentrated on the development of hypertriglyceridemia after diabetes mellitus, what you have just said, but we plan to do it as a reverse to see that how hypertriglyceridemia can contribute to the development of diabetes. But thank you.
I have a question on that exact note, continuing like, did they exclude in the individual studies pre-diabetes?
Most of the studies, yes.
Hypertriglyceridemia?
Yes, most of the studies, yes. The only problem is that I plan to exclude those patients, or I hope to find articles on that, who have even excluded those who have insulin resistance or something like that. But usually insulin wasn't measured as just a usual checkup, but prediabetes and diabetes was usually excluded from this.
Do you have data on the risk of pre-diabetes in
we plan to find
Wonderful.
data on that, but
congratulations for the progress. Forgive my ignorance, but as I know that there is difference between males and females regarding diabetes, like hormonal changes or gestational, and there is difference in the risk. So
in the gender distribution,
like,
we plan to use a subgroup analysis on how female and male has the chance of the diabetes development.
Thank you.
Thank you.
Yeah, I have a question. Hypertriglyceridemia can be a part of a broader metabolic disorder.
The metabolic syndrome.
Yeah.
Yes, we excluded those patients who had metabolic syndrome at the
and what about
baseline
the
as well.
obesity, BMI?
We have data on BMI. There were population who only investigated obese population, we have excluded those. But there are articles which report a subgroup analysis on the BMI, and we plan to do a subgroup analysis. But usually the cutoff points are not the same. Usually the Chinese article use entirely different cutoff points. So I think that we will only be able to use it for the systematic review part, but not on the meta-analysis.
But you have more than 200 publications.
Yeah, but most of only 30 of them on the different triglyceride level. The others, like about triglyceride glucose index and triglyceride to HDL ratio, so it's like different indexes, unfortunately.